My name is Luke Hodgson. I'm an intensive care consultant at Worthing Hospital, and I'm the Associate Director for Research and Innovation at the Trust. Our Trust recruited over 7,000 patients in the previous year to national portfolio adopted NIHR studies. So that's a lot of participants in the year, but we are aiming to grow engagement in research. So we have a research strategy, a 5-year strategy, which central to it is to increase patient engagement in research. And across the Trust, we're aiming to offer the chance to participate in research to as many patients as possible. We know that research active organisations have better clinical outcomes for patients, better staff retention and satisfaction. So it's crucial that we continue to try to grow this engagement. Because we offer all different services for acute and elective care, pretty much across the board of the different divisions in the Trust, research studies are going on, so we have hundreds of studies open at any one time. We have long-standing strength in certain areas of the hospital, so for instance in cancer, in cardiac surgery, in cardiology and in surgery, but anything from intensive care medicine. When somebody's acutely admitted to the hospital, there may be multiple different studies that they would potentially be eligible for that we, at a department as well as a divisional level, try to offer the chance to take part in studies, whether somebody's admitted as a paediatric patient or under the care of the elderly. So there's a lot of different studies available to take part in. Yeah, nationally, there's a growing evidence base and acknowledgement that in the past we could have done better in terms of both where research takes part and who we've engaged with research. So we know that people from areas with more severe disease, more multiple morbidity, actually research doesn't happen as much there as it does in other areas. And we talk about underserved populations in research, which is the same in healthcare as well. But we know that, for instance, if you're from a particular socioeconomic background, you're less likely to be offered to partake and take part in research. And there's a lot of reasons for that. There's obviously different perspectives on this, but we did work where we used lots of different contacts, both from, for instance, research staff, clinical staff, and families and friends, and went into lots of different communities in Sussex and talked to different populations. And so we tried to target a range of different views and different age groups. But for instance, we spoke to a number of people who had taken part in research and asked them their views on, what was positive about it, what were the challenges. Then also we talked importantly to people who had been offered to take part in research but declined to take part, and tried to understand some of the reasons behind that. And then also we spoke to a number of people who'd never been offered the chance to take part in research. So despite them having a medical condition and they'd been to the hospital, they hadn't actually heard of a particular research study in their situation. So we got a lot of interesting, important views that we put together in a video, and some patient stories, which can be quite powerful and summarise some of the challenges which are known locally as well as nationally. But these revolve around, for instance, when people of working age and have got a busy family life, actually they don't have time to take part in even more visits to hospital. Somebody who comes from a low socioeconomic background might not have the money to even get to and from a hospital if a study involves multiple visits. And then around health literacy, so taking on board information for someone with good health literacy. This might not seem a challenge, but it can be for a number of our patient groups. So we got lots of these different bits of feedback, and that I think provides information that then can be used for people to take that into account. And so it might be, for instance, that some of the perceived challenges to a person actually are not true. So particularly after COVID, things have switched to using different modalities to take part in research. So for instance, there's lots of options for using phones or texts or by email or Teams or Zoom. So rather than having to go and visit the hospital separately, a lot of studies can actually be done without providing a lot of burden to a participant. The research teams, I think, learned a lot from this work that was going on to take those things into account. And so, for instance, trying to combine, if a patient was coming to the hospital anyway, to combine that with a research visit. And so it's sort of overall trying to minimise the burden on a person who's already had medical problems, trying to make it as easy as possible, and providing information that's simple. And so, for instance, it might be that certain studies have an incentive or cover travel costs, and so that can be sort of highlighted to make it really clear that obviously these things are people are free to take part. It won't affect their care if they don't take part, but if they're interested, it won't be a big burden on them. Yeah. We've been very, very privileged to have research champions at the Trust for a number of years, particularly at Worthing, who provide great feedback on people's studies and can help whilst running the study. But they would themselves put forward that disproportionately that the background of the research champions was a retired group, and so we wanted to try to broaden that research champions group. And so again, we went to the communities across parts of Sussex to talk to people with the research champions, try to engage a broader group of individuals with this, because I think having that steer from the working in partnership with the public, if you've got a relatively narrow sort of feedback, you don't get as much benefit. And so we've worked hard to try to broaden that, and that's something we will continue to be trying to evolve over the coming years. COVID was a pivotal time for research, because the public took on board that it's crucial to improve care. And I think what we've learnt from the work that we've done is that patients are very enthusiastic when they're given the opportunity to take part, and it's incumbent on us to offer as many opportunities as possible to do that. At the same time, we understand that when people have already got medical problems and challenges in their daily lives, making research something that's not a burden, it's made as easy as possible, and we take into account all these different backgrounds. And we understand that the best way to do this is to involve our patients and public as a partnership, and continuing that journey together makes things much more easy, because we understand challenges together, and then we can use the benefits of both their viewpoints on things alongside the clinical team and researchers' views as well.